Good afternoon, and thanks everyone for joining us again today. Before I get too far into the remarks today, I'm going to be leaving shortly after the press briefing today. Dr. Williams will be here to finish up today. We'll take a few questions. I'll take a few questions when I finish here, but we are going to kind of get on the road pretty quick. I got a granddaughter. I'm going to be at her graduation tonight, so we got to head out here pretty quick to get to that. So I just want to give everybody a little heads up why I'm going to be walking out of here when this is over. As I have said many times this week, COVID-19 testing will continue to be a major priority as we move forward. We cannot fully recover economically without increasing our testing numbers. We have made great progress over the past month in regard to testing, but we must do more, much more. Time and time again, I have said that we make our decisions based on Missouri-specific data. The more testing we do, the more data and knowledge we have on the situation in Missouri, and more confidence and reassurance we can give Missourians as we work through the recovery process. As I said earlier this week, I have set a goal of reaching 7,500 tests per day. The plan focuses on three main testing strategies: box-in outbreaks, Sentinel Testing, and community sampling. We have already been utilizing these strategies, and we will ramp them up even further next week. First of all, let me talk about the box-in testing. The box-in strategy will focus on congregated living facilities, specifically long-term care facilities, with a daily target of approximately 1,850 tests per day. We have a total of 163 long-term care facilities that have had a positive case, either a resident or staff or both. The goal with box-in testing is to go into these high-risk facilities where there has been at least one positive case and execute facility-wide testing. This will allow us to keep the virus contained by identifying and isolating additional positive cases as quickly as possible. Now, Sentinel testing. With Sentinel testing, our goal is to perform testing at state-owned facilities across 28 counties, specifically those overseen by the Department of Corrections, the Department of Mental Health, the Department of Social Services, and the Missouri Veterans Commission. Our testing targets for this strategy is approximately 1,440 tests per day over a 10-day period. By performing Sentinel testing in these facilities, we can identify and isolate not only symptomatic individuals, but also asymptomatic individuals to keep them from unknowingly spreading the virus within the facility. Community sampling. With community sampling, we will set up testing sites in different counties across the state. And anyone who wants to be tested will have the ability to do so. We have already completed community sampling in 13 counties. For this plan, we'll be targeting 6 additional counties over the next 10 days with a total daily testing goal of approximately 975 tests per day. In addition, we have also delivered 9,000 test collection kits to the St. Louis Region Task Force, with another 9,000 to be delivered next week to continue the broad community sampling. I want to point out that just because we come to your community does not necessarily mean that there has been a spike or outbreak in your area. The selection of these counties is based on locations with the ability to draw participants from a broader region and locations that have expressed a need for additional testing resources. By doing community testing, we can get a better idea of the prevalence of the virus in these areas. which will help guide our response and ease uncertainty for Missourians. If the prevalence is low, this will reassure citizens and businesses that it is safe to begin re-engaging in the community and returning to somewhat normal operations. If the prevalence is high, we can quickly and proactively keep the virus from spreading further in the community. Over the next 2 weeks, we will aggressively execute on these 3 areas: box-in testing, Sentinel testing, and community sampling to reach our 7,500 goal. I want to point out that our plan is based on what we can do at the state level to help jumpstart testing volume. Hospitals, healthcare facilities will continue their normal testing operations. Once our testing numbers are up, we will be able to reevaluate and determine what is needed moving forward. Again, I cannot emphasize enough how important testing is to the overall recovery plan. All 4 pillars of the recovery plan are important, but testing will be the key. The more testing we do, the more knowledge we have on what the situation in Missouri actually looks like, and the better equipped we are to move forward. To wrap things up today, there will be no briefing tomorrow or Monday. We will resume briefings on Tuesday, Wednesday, and Thursday next week to provide updates. As we move into the Memorial Day weekend, I want to again remind Missourians to be safe, to be smart, and to be responsible. We want everyone to enjoy the holiday, but we cannot let our guard down. As you get outside and spend time with family and friends this weekend, please remember to be cautious, and social distance should be a priority. Holiday or no holiday, this is still the most important step we can take to keep Missouri on track. Teresa and I want to wish everyone a happy and safe Memorial Day weekend. Thank you, and God bless. Kelly, let's open it up for questions.
Governor, this is actually on the economy and state workers, but is keeping state workers working remotely permanently or at least indefinitely part of a strategy going forward?
Yeah, I mean, we're reevaluating like everyone else does, other companies across the state. But, we're bringing people back to work every day. But we're also going to look how we do things more efficient and how we do better. If we can do things better now that we know remotely, that's fine too. But every day we're evaluating that situation. But we're bringing a lot of people back to work on a continuing basis to who needs to be here. But if we don't need them here right now and things are going well, remote, that's great. We'll just continue to do it.
Thank you.
Hi, Governor. You mentioned with the community testing, if there is a high prevalence, that we'd be able to put a stop to it pretty quick. Would that look like more restrictions, more like stay-at-home orders, or what kind of ways, if there is a high prevalence in a community sampling, what kind of ways would you?
Yeah, I think first we go back to what we're talking about today. We got to go in there and we got to test and see what we really got, and we got to evaluate that and see how widespread that is in a community. Or is it a certain area we can just address to that issue, where that might be. And let me just take, because there's been a couple of issues around the United States, I know, and one thing that concerns us, and I know as I talk to the clergy and the faith-based community, churches. Well, we have had a couple of instances across the United States and other states where churches come back and they have a little bit of a problem. So we need to keep all that in mind, but we'll be prepared to address that if it happens. But I don't think you're going to see a totally regional approach. You're probably going to be able to isolate it to where that issue is. And now that we have the testing capability and we kind of know what we know about the virus, I think we can do the box-in testing and kind of secure that pretty quick. I'm confident we can.
Thank you.
Governor, the CDC has released some guidelines for reopening schools. I wondered if that has given you a clearer picture of what the fall might look like, or is it still too soon to tell? Yeah,
I haven't seen the new CDC guidance on the schools yet. But what I'm hoping for is as things move forward, again, due to the testing, due to the information we have, the data, hopefully we're going to move school to where they start opening the schools up. We get back to some sort of normal function in the schools. However, I want to say this too, as we're moving testing, as I said yesterday, of the information I give you on testing. Why it is also so important to do it now is because that school season's coming, flu season is coming, and we're going to be in operations here in the next 4 or 5 months. So as much testing as we can do now, it prepares us for that season too, and that's critical for us to move forward. Because one thing, I think there's going to be some remarkable things done with some of the drugs that are out there, hopefully a vaccine. But right now, though, that's hopeful thinking, but I got to prepare that we don't have that. So that's what we're going to focus on. That's why we want to emphasize the testing so much.
Governor, do you have an estimate of the cost of these 3 different testing strategies? And then also, how's it being paid for? And are health departments at the local level or at the state level or both going to be doing this testing? Well,
First of all, I would say both, above, everything's on the table there. But here's the thing I think you need to remember. All the testing is pretty well right now going to be paid out of the CARES Act for the COVID-19. So there's a lot of money on the local levels for testing. That's what we're really emphasizing, that money they're sending out. So the local levels are going to be responsible for that too. The state's not going to come in and do their testing for them free. So if they have the funds and the resources to do it, whether it be the counties or the health departments, they're going to have to help with that. Number 2, when we go looking at it kind of in the private sector, we're going around there, if the companies have the ability to pay for it through the insurance companies, they're going to have to pay for that also. So I think there's a number of things that go into place there. But look, I don't think anybody should be expecting the state to come in here and do this all for free when they have the capabilities to go through their insurance companies, or they have received COVID-19 funding through the CARES Act. They're going to have some responsibility on their own.
What about with like Kansas City, for instance? It's having a funding battle with the county. How's that going to work? Are you able to go in and help them?
Well, I think we'll help Kansas City, we'll help St. Louis, we'll help Poplar Bluff, we'll help Bolivar, Missouri, my hometown, wherever they need help. But we're not going to get in the middle of turf battles up there. That's an issue up there between the county and the cities and in that region. So again, I'm not sure that's my place to fight that battle. But look, I've said all along, and I've talked to the mayors weekly and talked to them, we are here in a support role to help them. And that's where the state role comes in. I don't think the state's here just to take over the local levels and tell them what to do and what not to do. We're here in a support role. We're going to continue to function in that manner. All right. Thanks, everybody. Hope everybody out here has a good weekend. I will see you next week. Thank you. Dr. Williams?
Thanks, Governor.
All right. Any questions for Dr. Williams? Yep.
Dr. Williams, good afternoon. Looking at the new dashboard, it appears that there were 30 new deaths, and yet there's like a daily tracking number that was different. It had a lower number. Were there 30 new deaths? Is that the biggest jump we've seen in one day?
Yeah, thank you for the question. And I think one of the things we try to point out is that with the deaths, even though they're supposed to be reported in 24 hours, that has not been the case. And so when you see a spike like that in one day, people always think that means 30 people died the previous day, and what was that all about? But often that will reflect a period of time. So we are dependent on that dashboard on when it's reported. So what I would really encourage you to do, even though we take great effort to be granular and give it to you on a daily basis, what I would encourage you to do is to look at 3 and 7 day trends for those. But to your point, 30 deaths are 30 deaths, no matter when they happen, and we lament all those, and it makes us very analytical as to why that is. Our number of cases for the last month, new cases, has hovered around 150, 140, but our deaths continue, and we know there's always going to be a lag between new cases and deaths of about 3 weeks. And so we think that's what we're seeing, is that sadly those 30 deaths represent new cases that were from 3 to 4 weeks ago. One of the things you see in this disease is that a large number of people who end up on ventilators pass away. And many of them, the average time they're on those ventilators can be 14 to 17 days. So, not to expand too much on your question, but it's why we think it's so vital what the governor's talking about. Because if you want to decrease those deaths, we truly think you have to move way upstream and prevent the number of cases. Our average age of death in Missouri is 77 years old. And so if you want to decrease that 30 number, you really need to move way upstream and decrease the number of 77-year-olds getting the disease. Because what we've learned from this is that once they're on a ventilator at that age, there is a very high morbidity and mortality.
Hi, Dr. Williams. Governor Parson mentioned different testing goals for like community sampling and testing those 6 different counties. What happens if you don't reach that testing goal by a significant number? How does that affect how you view the coronavirus in Missouri?
Yeah, I think the goals are there from a public health strategy of what we think we can do. Our goal is to do more testing, both for patients and for helping us with policy. So in those 3 buckets, that number really derives from the fact that we know we're almost up to being able to do 10,000 tests a day. And as the governor has said, and I've said, it's like developing muscle. We've now got more than 150 mobile testing sites out there. We want to develop that going into the fall, and we wanted to have this capacity to test. So right now, if you look at our Sentinel testing, for instance, we will be doing, in a very rhythmic way, testing of nursing homes and meatpacking plants and long-term care facilities, all of those. So this isn't just right now. We're going to be doing this on an ongoing basis. If you looked at our boxed-in strategy, all 3 things have started already. We're in Andrew County tomorrow doing, I think, 500 tests as part of our surveillance. We're already in, by Wednesday, we'll be in all 50 nursing homes doing our testing for the boxed-in strategy that have had 1 patient in the last 14 days. And we've already started our Sentinel testing in our state facilities. That started, I think, 2 days ago. So that number will just naturally happen based on our projections of how each of those parallel items, what we think, just based on how many state employees we have, based on our prevalence, and based on how many nursing homes we have. I mean, we know right now we have 9,000 people to test in those 50 nursing homes. We already know that. So that's kind of where that number comes from. And one thing, an earlier question, which was a great question, funding. I testified this morning before Chairman Fitzpatrick's working group, and we've received $135 million from the federal government for testing in addition to the CARES Act funding. So we will be spending some of the money on that, and as the governor said, we will also be developing other funding streams. I do want to put in a plug, is that I know the governor has been great. You know, that $500 million or so that went out to local counties has to be spent on COVID-related items, and certainly a huge part of that is our local health departments. And so we're greatly hopeful that the county commissioners will spend some of that money testing capacity within their own county. So we have the $135 million we'll be spending from a state perspective, and some of that may be going out to counties. But we also very much want those counties to develop their own capacity, whether it's antibody testing or boxed-in strategies. So we're fortunate with that new funding from the federal government and the money we've sent out to have multiple funding streams to obtain our goal to do as much testing as we can here in Missouri.
Both in terms of the goal of 7,500 tests a day and also the numbers that are tracked on the website, is that strictly active case viral testing, or does that also include antibody testing?
No, it does not include antibody testing. About 4 states have gotten in a lot of trouble because they tried to conflate their numbers, I think, to drive up their numbers, and we don't do that here in Missouri. As I mentioned the other day, we've done about 13,000 serological tests through our commercial labs, but the numbers you see are just PCR testing by our commercial and state labs.
And then under any of these 3 strategies, if someone does test positive who didn't know they were infected, what's the system in place to support their isolation? Would they be sent home from work? Would they still be paid? If they can't go home, where would they go? Yeah,
no, that hasn't changed, is that all positives, whether serological or by PCR, are reported within 24 hours by law to the health department. Will then go out and talk to them. They will isolate them, and then they will do contact tracing. So in all of our strategies, whether it's prevalence, Sentinel, or boxed in, that component remains the same.
So they would be sent home and be isolated there?
Yes, they will be isolated, yes, if they're positive. And normally, the guidelines have changed on that, but normally that would be 10 days from when they tested positive and they had been asymptomatic for a period of time.
Thank you.
You're welcome.
Hi, Dr. Williams.
Yes.
You spoke a little bit yesterday about the remdesivir, so
Yes.
just curious about an update on that from, where did that go?
Yeah.
And if you have any idea what type of patients get that in hospitals.
You're gracious to ask that. We got it in, and I think we just shipped it out an hour ago. When I left to come over here, it was going out the door because we've received national recognition for doing that very, very quickly. We're learning from that. I think I may have mentioned to you earlier that you can either give it for 6 days or 11 days. And what clinicians are finding is that the 5 days works as well probably as the 11 days, so you can use it for twice as many people. We're distributing it regionally. So we send a disproportionate share to St. Louis just because they have the most cases, but we send it to every region. That's the distribution model we chose to go with. And what we're finding from clinicians is that the earlier you use it in people who are severely ill, the better they do. So it doesn't work as well for somebody who's been on a ventilator for 3 weeks, but it works pretty well on somebody who just went on one or is early in severe disease. I think the bottom line is, having practiced for 30 years, it's been our goal to let the clinicians, the doctor at the bedside taking care of your grandfather, grandmother, or whoever, to use their discretion, their clinical judgment on how that medicine is best used. And I feel really good about that here in Missouri, is that we've not been bureaucratic about it or tried to be heavy-handed. We've said, look, you're the doctor, that's your patient, you use your best clinical judgment. Thank you for the question, though.
Yeah, Mr. Williams, are you aware of any outbreaks in local jails at all?
The only one that I was aware of that I was very concerned about was St. Louis County, working with Springs Schmidt. I know about 7 days ago, she was concerned. I don't think they had an outbreak, but she wanted to do surveillance testing, and so we sent her 600 tests, and they were supplying 600, and that was about 8 days ago, I think. Time kind of runs together now, but that's the only one that comes to mind. And then I think in Lincoln County, we had a situation as well. Those are the two that I remember. But going forward, one of the things I've told the county commissioners as they look to spend their CARES Act funding is that we are very much going to be interested in all our jails that are usually run by the county to do surveillance testing, Sentinel testing, going forward. The periodic, just to check staff and guards and inmates as an early warning system. So that will change.
Okay. My understanding is that Sentinel testing is not covered by insurance. So is the $135 million going to cover the cost, not only for the test, but actually on the patient side?
Yeah, I think that's all evolving. It's a preventative test, and so usually insurance will pay for a preventive test because they save money if they can catch things early. Now, to your point, I've heard, now that we're kind of coming out of the acute phase, different insurance companies are saying different things, and so we'll have to see how that evolves. But in the immediate future, we have both the $135 million from the federal government for testing that would be available to us, and we have the CARES Act funding that has to be spent on COVID-19 activities that would be available at the local level. To your point, what if this is an issue a year from now or a year and a half, and we're very much already thinking ahead of what Sentinel activities would look like after those funding streams might not be available? We're thinking about that. So I don't have an answer for you, but we are thinking about it, what that would look like. Can you give us
kind of a, you say you're going into different places next week. Can you give us kind of a breakdown on what counties and what sites you're going into?
I can. We're going into 28 counties in our state operated facilities. So those are all our veterans' homes, our prisons, or at least many of our prisons, and all of our behavioral health facilities. So those are in 28 counties. Then we're going in and doing our surveillance testing, and make sure I get this right, in Jackson, St. Charles, Jefferson, Greene, Cape Girardeau. We'll be in Andrew tomorrow. We're going to be, I think, in Pemiscot, New Madrid, and I'm leaving one out, I know. I feel like, Boone, I'm sorry, that's it. We'll be in all those counties doing surveillance testing. And the reason you would say, why did you pick those counties? Well, we've already done 13, as the governor just said. We did those about 3 weeks ago. Had 9 positives out of 3,000. And we're going to be doing some more extensive testing in Perry County next week around something else. So, and Perry County just did surveillance testing about 3 weeks ago. But those areas represent 2 things. One, they're regional. So it's important. You don't have to live in the county to get your test in those areas. So we picked Cape Girardeau because it's a hospital hub that a lot of people from the surrounding counties would naturally go to for testing. Same thing with Springfield. Springfield has a catchment area of about 20 counties where people go, oh gosh, I'll go to Springfield and get my test if I live in Webster County or one of the Polk County or one of those counties. So it's important to understand that even though they're in those counties, the testing is intended to be regional. You don't have to live in the county to get the testing for the surveillance. And the other thing was those counties had reached out to us and said, look, we'd really like to do robust testing. So that's that.
I didn't quite catch the first daily goal for boxing testing, but regardless, I don't think they altogether add up to 7,500 per day. So is the gap private labs? Is that what fills that gap? Or?
I'm sorry. Yes. Right now in Missouri, we're doing about 3,500 to 4,000 tests, just clinical tests. That's people having preoperative procedures where they're doing a test or they're going in and the doctor's doing the test to make a diagnosis, that kind of thing. So right now, what I call clinical, doctors just doing them, is about 3,500. We will be layering on that about an additional 4,000 that's very purposeful, very strategic, and incredibly helpful. So again, I will say to all those patients, thank you for willing to do that. I think if you look at the places we've been, I've been overwhelmed personally as a clinician how much it's meant to go into parking lots and put up mobile testing sites. There's really an eagerness to get that. And again, just want to thank all our veterans as Memorial Day, and thank the governor who's a veteran, and hope everybody has a safe and good Memorial Day. Thank you.